Okay, good. All right. Like Amanda said, thank you for having me here. I'm a family doctor, and I almost joined the CDC. They offered me a job, and I couldn't take it at the time. There's a lot to get through, and I'd like to focus more on the science of things because I feel like that's where there are a lot of questions, hopefully, and then to apply that science to what you actually do to get back to business. And there are a lot of regulations put out by various government entities, and of course you need to follow all of those. So I'm not going to get into that, although I'll have like a short list of that. I think what I'd like to focus on is why that is, because the government guidelines will change. The science, we're learning more and more, but there's actually a lot of science that's already out there. And so I think it's important for you to know. Okay, so first of all, coronavirus is a family of viruses. Some of them cause the common cold, and some have caused SARS and MERS. And they are, this particular one has been studied recently, and it has been shown to be on surfaces for 3 days. So it's detectable still after 3 days, but not for too much longer after that. These viruses just kind of dry out, and then they can't replicate anymore. And by detectable, it just means that we can find parts of them that haven't completely disintegrated, right? And so it doesn't mean that necessarily they're infectious. So 3 days really is kind of the max on various surfaces. And then as far as the air goes, it does go into the air. It's still kind of debatable. Some people say that it's not quite airborne and that it's spread by droplets, which are where, like, if you cough and you have an actual drop of saliva on your hand and then you go touch a doorknob, that's droplet spread. But airborne would be when you talk or sing or laugh or anything along those lines. That actually can expel enough viruses into the air to cause problems. And there was you may have heard about the choir practice where out of 60 people, actually more than half of them ended up getting sick because one person was sick and they were singing in an enclosed space. And all of them actually were spread more than 6 feet apart. They were very careful about not touching each other, shaking hands, hugging, etc. But unfortunately, it still happens. So it is definitely airborne. I don't think it's been scientifically said just yet. Now, there are different kinds of testing out there. You've definitely heard about the PCR, and you may have heard about the antibody. The PCR is where they actually take a swab and take a sample of your mucus from the back of your nose. And the detection rate of that, unfortunately, is only 70%. That means 30% of the time, somebody who has the coronavirus is not being detected as being positive. And so then these 30% of people continue to walk around. So that's like 1 in 3 people continue to walk around, and they continue to spread the virus, right, to other people. And that's kind of what makes it so difficult to control this virus. And then the antibody testing, that's where we're looking for the actual response to the virus. So the PCR looks for the virus itself, and then the antibody testing looks for your body's response to the virus, and that's a blood test. And there are various problems. You can debate the statistics on that kind of stuff. So how does it spread, and what's the mortality? And you've seen mortality rates kind of vary from, is it just the flu, or is it like some deadly, awful 10% of people who catch it are going to die kind of a thing? And, we saw mortality rates of close to 8% in Italy just because the hospitals were so overwhelmed. But the true mortality rate, if everybody was able to get treated at a hospital, hopefully is closer to half of a percentage point. That's still 5 times more deadly than the typical flu. But it is definitely, it's bad. Okay, but it's not like catastrophic, right? I think the crux here that a lot of people kind of forget it's not the individual mortality rate. It's the fact that so many people have to be hospitalized. So the rate of hospitalization is 5 to 10%, or perhaps even more than that for any adult, and that's the problem. So the working age person is more likely to need or is significantly likely to need to be hospitalized, and so we don't want to overwhelm our hospitals. And if you see that little flashlight demo there, in the beginning when we were just starting out, we only had a limited number of tests. So we tested the sickest people. And so then we had a pretty high mortality rate because we were only testing the sickest people who were most likely to die anyway, right? These are the people that went to the hospital. And then as our testing capacity is able to be expanded, and then as we're able to do antibody testing to kind of look at things after the fact, we're finding that, hey, actually a lot more people have been infected. And so then if you look at the mortality, you know, how many people have died from this, that denominator of how many people have been infected is so much larger. And so then the mortality rate seems a lot smaller, and it is a lot smaller. Okay, so hopefully you understand why the mortality rate has kind of shifted over time, and it's not that the virus has changed or like anybody's trying to deceive you or anything like that. It's simply that we're finding more and more information over time. Okay, and it's also very important to understand what close contact means, and I think everybody at this point has a sense of it. It's being 6 feet from somebody else for at least 10 minutes. That's one case for close contact defined by the CDC. The other one is actually having infectious secretions on you. So if you're, you know, close to somebody for about 10 minutes and they talk at you, potentially some of their saliva could travel in your direction, right? And that droplet spread can infect you. And so then that's why we have the face mask recommendation. And face masks, just to clarify, is really more about preventing the saliva from somebody who's talking from traveling out, okay? So it's when you wear a face mask, you're protecting other people. And I think most people understand that by now. It's not that, you know, you're somehow wearing a bandana is going to help you from catching coronavirus. It doesn't work that well, right? Because you're still breathing in, you know, from the sides of the bandana and all of that. But your saliva is being trapped by that covering. And so then you're less likely to spread it to somebody else. Now, what if you don't have it? You don't think you might have it, right? But you might. And that's the thing. You won't know until a few days later. And I'll get into that. Okay. And this slide just kind of shows that a lot of people are going to need to be hospitalized. 2.5%, this is a CDC chart, of 18 to 49-year-olds, 7.4% of 50 to 64-year-olds need to be hospitalized. And that's a lot. And hospitalization, you know, nobody wants to go to hospital because you're really dog sick when that happens. And I guess, you know, why do we need to take this so seriously? It's not going to go away until we have the vaccine. We're going to have, it's just not magical. The summer is not going to deal with it. People are still going to be catching it over time, and it's going to come in waves in different areas, in different metropolitan areas. So our Erie and catchment area, you know, includes a few different counties. And we've only been dealing with it for about 2 months. It's just beginning. And so, you know, you need to kind of mentally prepare for a sick employee. You need to, you know, it's still early yet. You need to get those masks because you're going to be wearing them for a long time. And you're going to need to put policies in place. So it's, you know, all the quarantining and all the social distancing that we've done so far is great. so that we can keep the number of cases down so that we don't max out our medical system capacity. So everybody who needs oxygen can still get oxygen at the hospital. Everybody who needs to be in the ICU can still have a bed. That's kind of the goal for the social distancing. It's not necessarily that, you know, nobody's going to die, because people are still going to be dying over time. It's just going to take longer. It's that you know, the number of deaths is going to be spread out over a longer period of time, and also the people who need to be treated. And some of these people are young and healthy, right? They could be you, could be somebody you know, your neighbor, not just your grandparents. The viral shedding, this is kind of the key chart here. For the 2 days prior to symptom onset, so you don't even know that you're sick. For the 2 days prior to that, you're already shedding virus. And that's why it's so important just to wear that face mask, just in case. Because nobody knows that they're sick. Nobody's deliberately, you know, few people are going to deliberately go around spreading an infectious disease to other people. It's just that they're misinformed, or that, you know, they just don't know. This is the typical time course. So once you're exposed, you're infectious within a few days, 2 to 3 days, and then about 2 days after that, your symptoms start. And I have the key components outlined here in red. So symptoms start, and then after a week of symptoms, you either are fine, you know, you don't need to go to the hospital, you're still sick, but you have a stable illness, or you take a turn for the worse. That's kind of where the whole cytokine storm kicks in. I don't know if you've heard about that, but if you did, then that's kind of where it kicks in. And if you take a turn for the worse, then you need to be hospitalized. And then, but for most people, more than 80% of people, you won't need to be hospitalized. And those people will feel better after about a week or 2 weeks of symptoms, right? So either they're okay and don't need to be hospitalized, or they start to improve after about 2 weeks. Or anyway, okay. So after you're feeling better, you still continue to shed viruses for quite a while after that. It really takes about a full month for somebody to stop shedding viruses, to be completely recovered well enough that they're not still coughing and potentially infectious for other people. So the government guidelines are giving us you know, reimbursement for employee pay for about 2 weeks, but that's not quite enough to cover that infectious period. And the CDC says, you know, after 3 days of having no fevers, no symptoms, then you can go back to work. But symptoms is just coughing, you know, and there's a lot of coughing going on. That's the most common symptom, in fact. So that's 80% of people are going to exhibit coughing, and then 70% of fever. And that's why there's also the recommendation of scanning people's foreheads for a fever, because you're going to be able to catch 70% of them. And then the shortness of breath, that's really if you get bad. And then there are a few other symptoms as well: achiness, headaches, sore throat. Diarrhea is actually kind of interesting. And then the loss of smell and taste, you might have heard about that too. The things that we have been doing, the social distancing so far that we've been doing, have been everything towards the bottom of this list, which unfortunately is not ideal. So we've closed schools, closed businesses, you know, the 6 feet apart, all that kind of stuff. What's most important is to isolate the patients with the disease. And you may have heard about this one lady here in Erie County who was diagnosed, and she was actually on the phone with the infection control nurse. And she's telling the nurse, oh, hey, I gotta go because I got appointments. And then she goes out in her car and infects 30 other people. You know, she comes into contact with more than 30 other people. And then those people then need to be quarantined too. So this is the problem. You got to isolate these patients. And I don't think we've done a good enough job making sure that these patients stay isolated and really understand, like, you cannot go out. You got to stay home. And then once you've isolated these patients, you need to trace and quarantine all of their contacts. And those are the most effective things, period, that's going to keep this under control. But we have, here we've done a good job with tracing and quarantining, or at least informing people that they may have been exposed. Erie County actually has its own health department, but they're hiring right now because they're running out of capacity for their number of employees that they have. But through a lot of the country, this is not in place. The quarantining for the close contacts and contact tracing is not in place, unfortunately. All right. There was a question regarding screening versus testing. Screening does not involve like a laboratory test, so you can't prove somebody has the coronavirus because you're just checking their temperature, or you're looking at the list of symptoms that they have, and they have the loss of smell, which is very diagnostic, in fact. But that's just a screening test. You can't prove that they actually have it. The proving involves an order by a doctor, right? There are different medications out there. Vaccines are being developed. The vaccine's going to take about at least a year, and that's being very, very hopeful. And the medications out there, we're starting to find some things that may help, but they're not magical at all. They may help, say, 10-20% at this point. Even the remdesivir that you might have heard of is not great. Okay, there are different regulations. So getting back to work, all right. There are different regulations out there. There's the CDC, Pennsylvania, OSHA, local orders, and things like that. I'm sure, since we've been back in business now for a few days, you've already reviewed some of these and have tried to implement some of these guidelines. I think what would probably be most helpful at this point is to kind of go over what we did as acoustic sheep to help mitigate this issue. Okay, so let's see. I've talked to factories in China to kind of see how they've, some of our factory suppliers, to see how they've done things over time. And there's going to be a lot of supply chain disruptions and things like that. I think you need to also explain what you're doing as a business for social distancing, right? All right, let me see if I can pull this up. So Amanda, are you seeing my Google Drive? No.
No.
Okay. Here we go.
Sometimes you need to stop sharing your screen and then reshare it. Oh, there we go.
Okay. All right. Here we go. So this is, I've got a drive with all of the different announcements. So I'm keeping track of what I'm doing as a business, right? That way, and I'm keeping a diary and stuff like that, a journal of what we're doing. And that way, if going back, if we did something wrong or we did something right, and unfortunately something still happened, I have the proof that I did, what we could, what we knew, and we did the best we could. All right, so back in March, I already set down some guidelines. This is before everything kind of hit, before the school shut down and stuff like that. Are you able to see?
Yes,
policies?
It's a little small.
Okay.
So I don't know if you want to maximize the screen. Oh, there we go. Yep, that works.
Okay. All right. And so what we decided early on was that we would quarantine everything coming in for about 5 days. At this point, it's 3 days based on some of the newer information. All the returns and stuff like that are handled using disposable gloves. We stopped contact. So between vendors, employees, customers, anybody. So just, don't touch anybody anymore. And encouraging the use of hand washing and hand sanitizers. And telling people, all of the employees to sanitize their own workspace. you don't want necessarily one person to go around and sanitize everybody's workspace with the same dish rag, right? Because then that potentially spreads it everywhere. What you want to do is isolate. So if there's one person working in one space, then that person should clean their own space. Now, common shared spaces, we do have a designated person to go and clean that area. If you are having trouble finding cleaning products, which you may, we use one called Force of Nature, and I believe they still are shipping, and it actually is quite safe. You can look that up. This is our internal documentation, right? This is what I sent out to our employees, and I've deleted some of the names in there. Okay, so there's one person who's cleaning all of the shared spaces, and in fact, we have, let's see here. Okay, so I have a spreadsheet here. Are you seeing the spreadsheet?
Yes.
Great, okay. So this is just kind of an example. You're gonna be able to make your own spreadsheet, right, for all of the different places that you need to clean. So there are areas that we are cleaning on a regular basis, and then we decided not to clean the lunchroom. Okay, so all of our employees are not to use the lunchroom. They're not going to be eating lunch together. And so that's where we said, okay, these areas we're definitely not going to clean. And so it's transparent. Everybody knows what's supposed to be cleaned, how often, and what's not cleaned, right? Okay. And so then we also asked our employees to tell us if they're traveling outside of the area. And we're discouraging traveling outside of the area, discouraging large gatherings. We're telling our employees to stay home and to not come to work unless you're fever-free for at least 24 hours. And if you might have the coronavirus based on symptoms, then you're not to return to work until we are sure that you definitely don't via testing, okay? So they need to be going to the doctor for a test. And it's free, right? The government is supporting those the testing at this point. And what I also did was we gave all of our full-time employees an additional 5 days of PTO, and I told them to use this wisely. And if you run out of PTO, then and you come to work because you want the money, then you will be written up for insubordination. Okay, so I'm not mincing words. Like, use your PTO for being sick. We're giving you extra. We're doing a nice thing for you. You use it wisely, right? And then I go into some of the symptoms and kind of what to do if you actually do have symptoms of the coronavirus. Now, this was in March. This is our May announcement now. I'm pulling up our May announcement. And so here I outline what the office employee expectations are, what the warehouse employee expectations are. So I'll give you a little background on our company. We ship all over the world, wholesale, and we also sell direct to consumers through our website. And so because we're e-commerce, we are considered essential and also life-sustaining. So we were able to work, although I cut back a lot of the potential interactions. And all the office employees who can work from home are working from home. The warehouse employees, we had only one person in at a time when we were doing the life-sustaining period. And so we were only shipping twice a week. At this point, since we've moved to kind of the yellow phase, we are moving to a 2-shift type of a work schedule. And we're continuing to disinfect frequently. And we have a system where people can clock in and clock out from their phone. So it's actually an app that they can download. And so that way people are not congregating as they come onto shift at like a time clock, for example. And then as far as social distancing guidelines at work, we've mandated wearing masks for the entire day as directed by the state. It's difficult, but it's necessary. The only time they don't wear a mask is during meals. And at that time, they should not be in the same room as somebody else. So you can only take a meal in one room at a time, and they have to, not be talking to other people when they have their mask off. Here I go into, and I'll share all of this with you later. So I kind of divided up what to do if you suspect illness or an exposure when you're off shift, which is a lot easier to deal with, versus suspected illness or exposure on shift. And hopefully everybody stays off shift. But, if you get called by the health department informing you that you've been potentially exposed to somebody during your shift, then unfortunately, that as a business, you're going to have to deal with that. If one of your employees all of a sudden starts coughing or starts to feel poorly during a shift, they need to be sent home, and you're going to be stuck, kind of dealing with the aftermath of the cleanup of the potential exposure. Because, let's face it, at this point, if anybody's sick, the first thing that you have to assume as a worst case scenario is the coronavirus. So as far as symptoms go, this is the list of symptoms as per the CDC. I would also add unexplained fatigue and achiness. If you haven't been exercising a lot or carrying heavy things, then you should not be fatigued or achy. And some people have their personal indications of illness, and people need to pay attention to that. And some people just don't even know that they're ill until they're really, really sick. And so for those people, they need to be taking their temperature every day at home prior to coming into work. If somebody is sick, then you need to close off the area visited by the sick person for the past 48 hours. Because as we said earlier, you're infectious for 2 days prior to being sick, prior to coming down with symptoms, right? So you need to close off the area, try to ventilate the area. And these are out of CDC guidelines, actually, closing off the area and then ventilating the area. This is what the CDC says you need to do. And then after waiting 24 hours, then presumably everything that's floating around in the air has settled or has been kind of deactivated. And so then you can safely go in and disinfect the area while wearing appropriate mask, gown, gloves, all that kind of stuff. You don't need a special outside contractor to come in to disinfect. Your own employees or even you yourself can do it when you're appropriately dressed. And there's some CDC guidelines that go into that. Okay, so let me go back to the slideshow. Okay, now we're back to the slideshow. So you need to explain what you're doing to protect your employees, because your employees are the ones that are interacting with all of the customers. And so if your employees are sick, they're a liability for your company because they could get other people sick. And if it's traced back through contact tracing that your business infected multiple people, you're going to be in a lot of trouble. So you need to kind of go through also from a kind of stance. You need to go through being a paranoid customer coming into your shop or your store, or how you interact with anybody on your on the team as the business. What a customer experiences and what they would want to see. All right, so I have a lot of slides here kind of going over what we did, and you can scroll through that. We'll share all of this afterwards. At this point, I just want to kind of go over what I see for the future so that you can have some expectations for how to plan. We're still kind of in the shock and then starting to take some definitive actions at this point. So we're increasing our testing capacity. We are definitely isolating cases. And in this area, Erie area, and in the New York area that's close to Erie, it sounds like we're all doing the right things as far as contact tracing goes and quarantining the contacts, which is all great. And we've definitely kept cases low, but it's going to continue to spread. And as we open back up, and I've seen a lot of people gathering, we're going to see another spike soon. There's about a 2-week delay for when there's an interaction with a lot of people to when somebody becomes symptomatic and gets tested positive. So we're going to be seeing that soon. And then hopefully people will wise up and stop really, playing sports together or stuff like that. Outdoor sports certainly is a little bit safer than indoor sports, or singing or anything along those lines. So we're going to see areas, specific areas with increased rates, and then those areas will need to increase their social distancing measures, and then loosen them up when the hospitals are not overwhelmed. And it's going to be kind of a dance for a while on this until the vaccine comes out. The vaccine's going to come out hopefully by next summer at the earliest. And even then, the production capacity may not be there. And so it's going to take time to kind of get everybody vaccinated. And I'm really hopeful that we are going to have a vaccine. I think that by the fall, so summer, there's going to be still a lot of social distancing. There's not going to be a lot of summer camps and stuff like that. But by the fall, schools should be able to restart. And in China and in many other countries around the world, young kids are required to wear masks. Whether or not that really helps, hard to say, right? Because we all see the people going around touching their face, adjusting their mask. So what I've done with our employees is to suggest that they put a piece of tape over the bridge of their nose that will help to hold the mask in place and not constantly get into their eyes or shift around on their face and be uncomfortable. And also what that tape will do at the bridge of the nose is to prevent glasses from fogging up. Let me see here. I actually put together a video, and I'll share that video with you on how to wear masks and how to clean and how to take your gloves off, and how to, let's see, okay. So this image here of my son shows how that piece of tape kind of holds that mask in place, and then also prevents your glasses from fogging because you don't have the air coming out from the sides there. So I'll share a video with you as well on how to, take your gloves off, how to take off your gown. So you always take your gown off first and then your gloves, wash your hands, and then you can take off your face mask and then wash your hands again. And that's how you can do that safely. So I'll just wrap it up now because I'm running out of time and I want to give Elizabeth still some time to talk. Hopefully this was good information. If you have any questions, I'm happy to answer them. Thank you.
Great. Thank you very much. So we are going to transition now to Elizabeth Cipolla with Decision Associates. Just a quick reminder for everyone, if you do have questions, please drop them in the chat feature. If we don't have time to get to them today, we'll make sure that we capture them and send them out with answers in the follow-up email. And I will be including a replay link for today's presentation, as well as any materials that our presenters share with us to redistribute to you. So without further ado, Elizabeth, take it away.
Hello, good morning, everybody. And Wei-Shin, excellent job. I'm going to be able to share my screen as soon as you click stop share for yours. So no worries. So I'm glad Wei-Shin was able to go over much of what she went over with us this morning, because I'm going to be able to, really piggyback on a lot of that and give everybody some things to think about. So the focus that we're going to be spending, you know, the next 25 minutes or so on is really focused upon getting back to business. Now, for those of you who might have some compliance related questions, I will also send you some compliance related links and information after this presentation. But I really wanted to make the best use of our time together this morning because there's so much we could cover to really get you focused on what you need to think about when it comes to getting back to business. I also just want to throw out there, I believe Amanda had mentioned, at least in some of the chat correspondence, that she will be allowing this to run a little bit over since we got a little bit of a late start. So for those of you who have to excuse yourselves before noon, don't feel badly. I know Amanda will share everything with you as well as a live recording. And for those of you who are able to hang on, that's great. Like I said, this will probably take about 20 to 25 minutes. So here's what we're going to be covering together. I'm going to give you an extremely quick introduction just so you have a little bit of a perspective of my background as it pertains to the material that I've chosen to cover with you today. I'm also going to be sharing with you some hot off the press, just released statistics and results of some survey findings based specifically upon Erie employers related to COVID-19. And then we're going to be delving into, you know, what's next, helping to prepare your organization. Notice I'm not saying after the pandemic has passed, because as you just learned from Wei-Shin, obviously that's going to be quite some time before that occurs. And really, you know, much of what she shared, as she explained, is her prediction, but and obviously she has a scientific backing to make those predictions, but really nobody knows exactly when it's going to be passed. So I want to make sure that your organization is as prepared as possible for what's to come. And then some helpful best practice tips, and we're going to wrap it up with the new future of work. All right, so here's a quick little screenshot. You can take a quick little glimpse to see what my background is. Obviously, I'm not an attorney, I'm not a medical professional, but what perspective I do bring to you for this webinar today is the perspective of being, you know, executive in human resources, and also most recently, a consultant, a management consultant. So you can see right here, I have various industries of, you know, industries that I've worked within, and also you can see my educational and credential background as well. If you need to contact me, there's my email address and my mobile phone number. Please feel free to call me, email me at any time with any question, even after today's webinar, and I'm happy to answer anything I can for you. All right, so now we're gonna shift our focus to, you know, preparing you for what's next. And as we do that, I want to first, you know, present some of the findings from a survey that we just conducted here at Decision Associates of Erie regional employers. And I should tell you that this survey took place a little bit earlier this month. And I should also tell you that the employers encompassed all different industries and also encompassed both for-profit businesses as well as nonprofit organizations. So of the respondents in the survey, 70% of Erie employers said that maintaining culture has been a challenge. 59% said that shifting communication to meet the needs of their remote workforce has been challenging. Half say that maintaining morale has been tough, and over half of employers experienced and are experiencing difficulties with productivity, leave, just really managing all those leave regulations, and also an increase in employee requests or referrals for mental health services. Again, all these stats that you see are in relationship with the COVID-19 pandemic. Some additional stats, 40% are requiring employees to work from home even after the government has lifted restrictions. And I'm glad Wei-Shin shared what she did in terms of the, you know, her medical perspective on that, because as she stated, it's going to go up and down. It's going to ebb and flow. So even though the restrictions might be lightening, you know, any, you know, employee or position that can still perform their job well from home or remotely, I've been suggesting this to our clients and also to those who've been participating in our weekly webinars. Please consider doing that for all of the good reasons that Wei-Shin outlined in her presentation. 57% of employers have shut down certain aspects of their operation. 31% of you have had to completely shut down your business, but you do have plans to reopen. And look at this, 96% of Erie employers have had to adjust business practices. And of those, here's a little sampling. 61% of you no longer hiring, 39% of you, you've had to lay workers off, 15% of you have had to permanently cut some headcount with no intent to replace those roles, 46% of you have had decreased employee hours, and 11% of you have reduced pay rates. 20% of you are offering additional paid leave for employees, much like what Wei-Shin outlined in her organization's plan to help employees navigate these uncertain times. All right, so bottom line, what does this tell you? Well, it tells us here in Erie that the priorities of your employees have changed, and also, of course, your organization's priorities have changed. So what I want you to think about is the fact that the playbook is being rewritten. Not only is it being rewritten, but it's being rewritten right now in real time. None of us, although there are many experts, a lot of us are putting our best guess based upon what we know in our respective areas of expertise, what we think it's going to look like, but nobody really knows exactly how the story will end. So what that means for those of you on this webinar is that you're going to need to be resilient, you're going to need to be innovative, and you're going to need to be agile. All of us are facing this pandemic and then the ultimate recovery together. So I really want you to understand that those of you who prepare for what's to come will weather the storm. And again, when I say prepare, you have to prepare in a way that allows for agility and innovation, because as we've seen up until this point, there have been a lot of changes that nobody could have predicted. So really what I want you to think about it. We're really living through what is basically a social experiment. And listen, when I say that, okay, let me be clear. I'm not saying that it's some big conspiracy theory. I'm just saying in reality, we don't know exactly what we don't know related to this pandemic and related to the outcome. And we've never experienced anything quite like this. So what we're living through is a social experiment. It's had a very significant impact on how we perform our work. It's had a significant impact on our mental and our physical well-being. And so the good news when I say that we're living through a social experiment is the fact that when you think about it, I think all of us can agree that experiments are the best way to learn. So I really want to challenge you to shift your mindset, reframe what's going on, and get out of a reactive mode and get into a proactive mode. So what can we do to learn from experiments, right, that can translate into your workplace? Well, as your employees are coming out of this crisis and as they're coming out of the different waves of this crisis and start coming back to work, take some time, talk through with your employees. What have you learned? What have you done differently to find a way to make work for you? Think about it. Your operations really will benefit from this opportunity to test out different routines and the way to get your work done and to meet your client or customer demands. Take time to evolve your best practices, understanding that as you reflect about what worked and what didn't, what worked last week or last month very well might not work next week or next month. So it's extremely important to continue having these conversations and really, learn from this experiment in which we're all living. Some other things I want you to think about. So your employees have changed. The employees that you said goodbye to, at the onset of this pandemic, 8 or 9 weeks ago, are not the same employees that are working for you today or that will be coming back to work with you. And why do I say that? Because the time that we've all spent with our family and the the news that we've all been grappling with, and many of us have even known people who've been personally impacted by this illness, it's changing the way that we look at our careers, right? So your employees' priorities are ultimately going to shift. It's already started. In the past, when we had the luxury, I should say, of deciding who we want to be flexible with, who we don't want to be flexible with based upon their respective positions, that flexibility that once had been requested of you as an employer is now going to transition into more of a demand if you would like to keep them employed. In addition to that, childcare is a massive issue. Your employees who previously had childcare lined up, 20%, they say, 20% of employees have lost their childcare options as a result of COVID-19. And that's based upon a study that was released a few weeks ago. So I'm going to venture to guess that that percentage is probably on the rise. If you have an employee who's been impacted adversely from a childcare perspective, they might not be able to come back to work in the office or on site. And even for those who can, many of those employees might not feel comfortable coming to work on site, especially until a vaccine can be found. So a lot of you, to keep costs down, maybe you'll ultimately decide what you need to do is to keep employees working from home into the future. And ultimately, some of your employees may opt not to come back. And when I say that, what I'm talking about specifically is the Families First Coronavirus Response Act. Now, the FFCRA provides some paid leave to employees who meet very specific eligibility criteria, some of which includes, if you have a school-age child at home, or if you have a minor, so basically someone under the age of 18, who you need to provide childcare for, if they have been able to juggle and make it work right now, and they haven't had to use that benefit under FFCRA, they may realize, if I'm being asked to come back, I'm going to need to take advantage of that benefit, and they may choose not to come back and work with you. So what I'm telling you, in case you haven't connected the dots, is that your leadership approach needs to change. And in some ways, you're going to need to be more hands-on. In some ways, you're going to need to be more hands-off. And, the ways in which you're going to need to be more hands-on is figuring out how your people are doing on a day-to-day basis, having those exploratory conversations with them, as I stated earlier, to see what's working through this social experiment that we're all living. And the ways in which you need to be more hands-off is in the areas where you prescribe and plan every minutia of detail about how your employees reach their desired end results and how they perform their work. And again, the reason I'm saying that is because many of your employees, especially those who've been working remotely, have had to get creative to find a way to make work. So, rather than being a micromanager of how they get their work done, instead, take a look at the progress they're making, take a look at the desired end results, and if they are reaching those goals, if they are producing the output that you need them to produce, be prepared to be a little bit more hands-off about spelling out to them exactly how they perform their work. All right, so now let's shift our focus on what it is you can do. And what it is you can do is think about what you've learned, all right? Think about how your organization can get things done differently other than what you've always done before. And many of us, right, aren't naturally inclined to want to change just for the sake of change. Many of us have gotten comfortable with how we've performed our work, but as you can see, 96% of you have had no choice but to have some change. So really, I want you to think about how can you redesign the positions within your organization to make them more meaningful and motivating amidst this, several months and well over a year that we have ahead of us with all of this change. Also, too, how can you give your employees more control over their schedules and or how they perform their work so that you can build that very crucial culture of creativity and higher productivity? I'm telling you now, if you don't seek and embrace a culture of innovation and creativity, your organization is really going to struggle to survive this pandemic. And I say it for all of the reasons that I outlined on earlier slides. Your employees have changed, the way you perform your work is going to need to change, and we don't know what's coming. So it is a perfect recipe for disaster if an organization or a leader of an organization refuses to embrace innovation and creativity. All right, so it's really, really important that you do that. Some more things you can expect, exactly like Wei-Shin outlined. The return to work is going to be choppy. So don't get lulled into a false sense of security because we're now transitioning into the yellow phase and anticipate that, hey, it's going to get better from here. The outbreak is forecasted to persist for up to 18 months, right? And even longer potentially, as Wei-Shin outlined. And along with that come the various local, state, and national restrictions to mitigate it. So I really want to encourage you to plan for, I've been telling our clients, up to 18 months of repeating cycles and waves of flare-ups, then the controls, until a vaccine is developed, I should say. And, you know, there have been some epidemiologists who've predicted that a potentially larger second wave of the virus could hit this fall. I don't know if that'll happen or not. And again, it's only a prediction, but you want to be prepared for that. I think all of us can agree we don't want to be caught off guard anymore. So some more things I want you to think about. Now, obviously, by this time, presumably, and I'm hoping that all of you on this call and on this webinar are aware of the safety procedures for businesses that all operations in the Commonwealth have had to abide by in order to maintain in-person operations. And if I'm going to include that as a follow-up document that I will give to Amanda to disseminate to those of you on this webinar, so that just in case you're not familiar with it, you can get familiar with it prompto. But it's important, as you can see here. There are very specific procedures that you have to abide by, including posting these procedures at your workplace in a prominent location and having someone who's identified within your operation as a pandemic safety officer. And that person would not only respond to, but also, you know, handle any questions regarding the requirements. So it's important that you make sure you are abiding. This is just one example, but it's important that you are abiding by the requirements being enforced by the local, state, and national government. Some other things I want you to think about as it relates to what is going to change. So I'm suggesting to you that you think about your operational practices and the practices that will need to change. I really like how Wei-Shin in her presentation, and I swear she and I didn't compare notes, but I like how much of what she laid out really shows some good practices for you to follow as an employer. So think about it, right? There needs to be, if we're going to have flare-ups and different waves of this virus, you're going to need to consider employer-paid hazard or premium pay. And why do I say that? Because for positions that, you know, fill work that can only be done on site, and if you are in an industry that, or if you run an operation that is deemed essential, should there be further, you know, government shutdowns for businesses, which I definitely feel is likely the case, you are likely going to have to consider paying a premium compensation to get these employees to come in who otherwise would be fearful to do so. In addition to that, your employees, they're going to desire more personal space, and they're going to desire a work environment with demonstrated documented, much like Wei-Shin did, higher levels of cleanliness. And you're also going to have to come up with alternatives to how you handled work-related travel in the past, or on-site meetings or visits with customers. And you're gonna have to think of something different as it relates to traveling to large gatherings and conferences. Those sorts of things are going to need to be cut way back. In addition to that, even beyond what the government is suggesting, consider rotating schedules, splitting your teams, staggering your workforce so that you don't have too many people in one place all at once. Just like what Wei-Shin outlined, how she is having people, check into work and clock in, I should say, remotely. She's having them do that from their vehicles before they enter the building. Those are examples of operational practices that need to change. Some additional things to think about: staggered break times and shifts. We've already seen that be recommended and mandated by the government, but it's going to become commonplace probably even after coronavirus, just because everyone's state of mind and awareness levels have been heightened. So that will minimize the risk of spread until a vaccine is released, but also after that, again, the psychological impact that this has taken on your employees, they're going to be skittish and nervous to congregate in large groups in small enclosed spaces as we once did before this hit us. There will be more questions raised of you by your employees regarding the hours that they work and where they can perform their work. Your employees are going to need more paid sick and family leave time because schools and daycare, they're going to be closed despite phases of returning to work. And I'm going to suggest that, it's great what the government has done to provide some paid sick and family leave time, but ultimately through all the different phases of this illness until a vaccine can be released to the general public, I'm going to suggest that what the government has provided is not going to necessarily cut it. So you as an employer are going to need to consider what you can do to fill that gap. And there will need to be continued resources, that you'll need to invest in to make sure that we have a dedicated process for cleaning and disinfecting. All right. So what is it you can do? I wanted to share with you some best practice recommendations. So first of all, define what your new normal is before your employees return to work on site. Create and revise policies as you need to. And I can't emphasize enough the criticality of having a competent HR resource who truly understands the compliance-related changes and their application to your operational practices and benefit offerings. I really believe that gone are the days where you can just, slap quote unquote HR duties on an office manager, let's say, who has no formal credentialing, education, training, or experience in HR. That is a very risky proposition for you to do because so much is changing in the blink of an eye and so much new legislation. And it's really risky if you don't have someone who is competent who can understand and help you to navigate that and mitigate risk. It's also important, just like Wei-Shin explained in her best practices that she did at her organization, that you communicate with your employees in a way that demonstrates a true concern for their health and safety. And, the examples that Wei-Shin showed from her organization really were an excellent example of that. When you do those things, not only will it obviously reduce the risk of illness or further outbreak in your organization, but your employees will also be more productive. And they'll do that because they'll see that they can take a deep breath and feel a little bit safer in your workplace than if they had been working somewhere who didn't demonstrate that. So some additional best practice recommendations: take a look at your existing flexible workplace policies and figure out if it makes sense to update these and make them more robust. I'm going to say it until I'm blue in the face. I think it's foolish for any organization to force employees who can perform their work remotely to come into work. And the reason why I'm saying that is because, as Wei-Shin outlined, we don't know exactly what the future holds, but what we do know is that there will be further outbreaks, there will be more spikes, and why would you risk the health of your employees and the ability of your organization to sustain operations, right, by having people come in and work on site unless they absolutely positively have to? Until a vaccine is developed, it's very risky. And be prepared to explain in a logical way to your employees what positions can continue to telework, what positions can, and lay out the business case as to why. Make sure you have developed policies that address, if and how you're going to conduct temperature checks. Develop policies that address cross-training, right? There will be, and there already has been, more employee absences. So a lot of employees have had to step up and do things that they didn't have to do before. So make sure you get ahead of this now and invest in cross-training to make sure you can cover that. Invest in, developing policies that focus upon social distancing, increase practices of cleanliness and sanitizing, and an emergency response plan for suspected and or confirmed cases of COVID-19. In what I send to you after this webinar, I will also share an example of a response plan that one of our clients gave us permission to share. And this particular client did have a COVID-19 case in their workplace. So again, I will be happy to share that with you. So as I prepare to wrap up, I just want to highlight for you one of the biggest changes that has taken place. And that change is the lifting of the stigma of working from home. And so some final thoughts I want to share with you about the new future of work. And these final thoughts, I can't take credit for coming up with them on my own. These were actually shared by the Boston Consulting Group just a few weeks ago. And it's based upon the predictions of industrial psychologists, economists, top CEOs, workplace behavioralists, and employment experts. So these are some final thoughts I'd like to leave you with, okay? So this is coming. And in many cases, it's already started to appear, all right? So no longer can we say, oh, we're immune here in this part of the country. No, these reflect the new future of work. So again, think about what you can do to be innovative, creative, agile, to figure out how you can make work for you and the new future. So number one, working in an office, that's going to become a status symbol. Most meetings will be replaced by email and instant messaging. It could be the end of business travel as we've known it. Office buildings will essentially become an elaborate conference center. Mandatory on-the-job medical screening could become the norm. Coworkers will become even closer. The standard 9-to-5 office hours will become a thing of the past. Home office stipends will become a common benefit offered by employers. The workplace will become more equitable for women. Middle management positions could be cut forever, and automation will be accelerated. If you have any further questions or thoughts or need any, subsequent information from me, I am happy to give that to you. Also, my colleague, Aaron Phillips, I'm sharing his contact information with you. But hopefully you found this time to be useful. Again, there's so much we could have covered, but I want to be respectful of your time. And that's all I have for you today. Thank you.
Great, thank you, Elizabeth. All right, well, with that, we're going to wrap up today's session. Thank you all for attending and for sticking around a little bit after the time allotted due to our little bit late start, but we wanted to make sure we covered all this great information just because there was so much of it, and I think there's a lot of questions and uncertainty as far as what the reopening process looks like and what this is going to look like as we move forward. So thank you to both of our presenters today. A couple of quick notes before we end. As I mentioned at the beginning of the session, we will be sending out a link to the replay of the session, so feel free to watch that. That'll be going out sometime this afternoon. And then I will also be sending out some additional resources that were provided by our presenters. So keep an eye out in your inbox for that. Additionally, another webinar we have coming up next week on Thursday, the 21st. I will send a link in the follow-up email to this as well. We're going to be featuring County Executive Kathy Dahlkemper, as well as Melissa Lyon, who is the director of the Erie County Department of Health. They're going to be answering some questions around sort of the relationship between the county and the health department and how they're working together to make sure that the Erie community stays safe and that we continue to stay on top of our mitigation efforts. So that's this next Thursday, a week from today at 1 o'clock. Like I said, I'll send that link out in the follow-up email. So I hope you all enjoyed today's session, and we'll make sure to get that follow-up email out as soon as possible. So thank you again for attending, and please continue to stay well and stay safe.